Department of ENT AFMC, for giving me this opportunity to speak today. So my topic is role of AI technology in defining diagnosis and prognosis criteria in head and neck malignancies. Basically, head and neck malignancies. One second. So basically, head and neck malignancies are has a very complex anatomy and has various subsites. Again, it has gone. So the anatomy is very complex, and each subsites behave very differently. The role of chemoradiation is there in laryngeal cancers, which is not applicable in early oral cavity cancers. The HPV related oropharyngeal cancers behaves differently as compared to non-HPV related oral cancers. So each subsites behave quite differently, and it is very difficult to give a common summary for all treatments. The prevalence of each subsite is also different. So these are the various challenges which we need to face. And the most important thing is the early detection and the early treatment, which will be very useful for a good prognosis of the patient. So what are the diagnosis related challenges? So first of all is the lack of awareness. So many of us must have faced, we being the qualified surgeons work in a tier 1 city, but most of the patients still come from the peripheral. Even the general practitioners at their level are not able to recognize the clinical picture also, or recognize the disease also. There is even not accessibility for CT scan or MRI scan. There is also underreporting. Hello. There is also underreporting of imaging reports. There are difficulties in the histopathological reports as well, where we can see clinically there are malignant features, but histologically it has not been proven yet. So these are the lot of issues we face in day-to-day practice. Even the advancement like PET scan has their own limitations, where we cannot detect micro deposits or circulating tumor cells at molecular levels. So these are the diagnosis related challenges what we face in day-to-day practice. And these are the prognosis related challenges as well, where on the left side we can see the molecular and genomic related challenges which we face, which is not in our control, and the treatment related changes which are partially in our control, but at some point of time that also we can't answer the questions of the patients, like what is the prognosis of the particular disease. So this is where AI is introduced in head and neck malignancies, where all these diagnosis and prognostic challenges can be solved, and we have a better answer for patient to give. So what is artificial intelligence? It has a very complex definition, but it makes our life easier. So where all AI has been used in cancer research, it has been used in screening, sensor-based detection, biomarker detection, self-diagnosis applications, in predicting of incidence, recurrence, and survival, and also in treatment where chemo medicines have been tried, AI-assisted surgery has been done, precision medicine, decision support system, and cell programming. So I'd like to first discuss about the mass screening. So how it has been done. There will be, it can be done at a tertiary cancer center or clinics and camps, where a rigid probe is used for imaging, that it will be recorded, and automated diagnosis will be there. And same thing can be reconfirmed with biopsy. And that is how in mass population, it can be, the artificial intelligence can be used in at least sort out some pre-malignant patients and malignant patients. Application of AI in tumor, in malignancy, it can be used in tumor imaging, cancer screening, tumor metastasis, cancer treatment, anti-tumor drugs, prognosis, mutation, and other applications. So how exactly artificial intelligence is used in tumor imaging? It is just the way like how Tesla uses in auto drives. First will be semantic segmentation, that it recognizes the group. Like how Tesla will identify where are the trees, buildings, roads, different cars. So first it will recognize the group of areas. Then it will mark the boundaries, like where all it is placed. And it will recognize the location, like in which area it is present, buccal mucosa, tongue, or whatever. So this is how it will recognize and segment the images. So in early diagnosis, AI can be used at patient triage. Suppose somebody are checking online symptom checkers, they can be sorted. General practitioners' decision, for them, it will be useful as a supporting tool. When they come to us, we can uh, segregate them as per diagnosis, alert, and risk threshold. In pathology, it is being used where lesion identification, radiomics, and deep learning classification is done. For biomarker analysis with machine learning and deep learning, whole genome can be studied. In cases of recurrence and detection and prediction, these models have been used with the help of electronic old health records, and automated eligibility screening with electronic health records are also being used. So these are the various applications where early diagnosis can be is helpful with the use of artificial intelligence. So now we'll discuss about the prognosis criteria. So it is a precision medicine. AI can analyze large data sets, including genomic profiles, pathology reports, patient histories, to identify biomarkers and genetic mutations associated with head and neck cancers. This information can help in tailoring treatments based on individual patient profiles, optimizing therapy choices, and predicting response to specific treatments. So there are various prognostic tools which have been devised. By analyzing diverse data sources, including imaging data, reports, treatment histories, and outcomes, AI can develop prognostic models. So I'll just give you some examples, like various models which has been tried in the head and neck cancers with the help of artificial intelligence. It is a systematic review article which they have studied almost around 20 to 25 AI used prognostic tools. And this is what the final outcome is. They have studied various endpoints like recurrence-free survival, distant metastasis-free survival, loco-regional failure, overall survival, tumor-related death, and disease-free survival. So these are the endpoints they have tried. This also tells us that the ability of algorithms to evaluate multiple endpoints are there. But the most important, and they have succeeded in developing prognostic models for overall survival and disease-free survival, which is what we need the most. These algorithms exhibit better accuracy than commonly used prognostic models, such as that rely on depth of invasion. However, prospective clinical trials are required to evaluate and use it as a tool for disease management. It also helps in improving treatment planning and enhancing radiomics and pathomics. I would also like to give example related to this. So machine learning to predict occult nodal metastasis in early oral squamous cell carcinoma. So they developed and validated machine learning algorithms to predict pathological lymph node metastasis in patients with clinically node negative oral cancers. So these algorithms used 5 clinical and pathological variables to predict the presence of occult lymph node metastasis and were trained using 782 patients. Machine learning consistently outperformed the predictive models based on tumor depth of invasion. So these studies have shown that machine learning or artificial intelligence will help in predicting occult nodal metastasis, and we can avoid clinically N0 neck dissections. At the same time, there's another study which was done by a machine learning prognostic system for loco-regionally advanced nasopharyngeal carcinomas based on tumor burden features. In this, they have used MRI scan to check the tumor burden of the nasopharyngeal carcinoma. And with the help of machine learning, they have concluded that high-risk patients who received induction chemotherapy and concurrent CTRT have a better 5-year distant metastasis-free survival than those who have only received. So such studies are being done, and it has been shown that this have helped in changing the treatment as well as prognosis. Another study I would like to quote is the artificial intelligence for HPV status prediction based on disease-specific images of head and neck cancers. But definitely it will not be as these algorithms were able to predict, but was not comparable to the routine P16 IHCs. And we need to exploit AI much in certain areas of the practice. Another model for predicting Ki61 positivity, it has also shown that it's a promising tool, but it can't be replaced. Real-time decision support and research and development are the other areas which has been working on to make it real-time support for the clinicians like us. I'd like to show the video where IBM Watson, IBM is a group of software company who are working with Sloan Kettering.
Cancer is the second leading cause of death in the U.S., and in the next decade, demand for treatments is expected to grow by 42%, creating a
In this,
shortage
they
of
have given us
1,500
an example like
oncologists.
how a
Meanwhile,
real-time
medical
patient
information
sits in
is
front of us
doubling
and a
every 3
clinician
years,
uses this
making it
software.
more difficult to keep up with the latest treatment options. Memorial Sloan Kettering has been training IBM Watson to help close the gap, as this live system example illustrates. Let's say I'm a clinical oncologist preparing to see a patient. I step into my office, and instead of spending my limited time digging for relevant information, I select my patient from the queue and use Watson to summarize the relevant facts from the electronic health record and identify areas where more information may be helpful. Next, I can match the patient to a clinical trial, or review the suggested treatment plans Watson has presented. Green means higher confidence, while red means lower. To make recommendations, Watson has extracted knowledge from guidelines, best practices, 12 million pages of journal articles, and 200 medical textbooks. Watson provides a visual timeline of the treatment plan, as well as the plan's
200
suggested
medical textbooks are
modalities.
not possible for
Again,
us.
they're color-coded by confidence level. Each of the blue icons represents an opportunity to dig deeper into evidence. For example, I can review the specific sources behind each component of Watson's recommendation. Watson has also suggested additional publications for my consideration, an overview of the protocols for administering the treatment, and a summary of information of the suggested drugs. When I'm ready, I can select the treatment information to add to the patient's medical record and share with the patient. This demonstration has shown Watson's ability to create an at-a-glance summary of relevant facts from an electronic health record, to suggest confidence-scored individualized treatment recommendations specific to each patient, and to transparently expose source data that supports the recommendations. Watson is helping oncologists fight cancer.
Definitely, it is very useful to use such softwares, but there are definitely certain limitations and boundaries for AI and machine learning. The first most important is the decision-making limitations. We always want to take our seniors' help, which is not possible with AI. There are certain bias limitations. There is a lack of common sense. Certain areas where we need to use our common sense and make that treatment some changes. Even some trials can't be done. And there are the boundaries of machine learning, because this machine learning also needs certain training, which is done by IT people, software-based people, and it also requires different kind of softwares. And ethical considerations, how much will this be validated, needs to be checked. So there is another, just to show an article where there are limitations of the AI, where it has not been able to diagnose between precancerous and cancerous lesion, which is a very important need for us. And the most important need they have not able to prove yet. And what will be the future of AI? So basically, we have to collaborate with the IT people or the software-based people for advancements in deep learning. There will be collaboration between human and AI, the way real-time support is required. Explainable AI and ethical considerations, with time it will be clear. And another future where we as a clinicians, where we are not directly connected with the software companies. So certain studies have been done, just like we open Google Chrome or some portal. So there will be a web-based prognostic tool where we have to just feed patients data, and they will be having tools, and we'll get the online prognostic calculators. And this may be the future, and with time there will be open access for such tools. Another future is we can take all the factors like mutation, gene expression, genomic, molecular profile, integrate into AI, and we'll have a multi-omic fingerprints. There will be a new pan-cancer classification, modeling clinical features. There will be cancer subtype modeling, and AI can also be used in drug response prediction. So just to conclude today's talk, AI technology offers transformative potential in enhancing diagnostic accuracy, refining prognostic predictions, optimizing treatment strategies, and driving personalized medicine in the field of head and neck malignancies. Its integration into clinical practice holds promise for improving patient outcomes and advancing oncology care. Thank you very much.